Imagine waking up one morning with a sharp pain in your stomach. It gets worse through the day. By evening, you have a fever. You feel weak, frightened, and you do not know what is wrong with you. In the modern world, this is an inconvenience. You see a doctor, you get a diagnosis, you take medicine, or you have a procedure, and within days or weeks you are very likely fine. You barely think about how extraordinary that is. Now strip all of it away. No doctor, no hospital, no pharmacy, no diagnosis, no antibiotics, no surgery as we know it, no understanding of germs, of bacteria, of viruses, of what is actually happening inside your body. Just the pain, the fever, the fear, and a small group of people around you who care about you, but who have no scientific understanding of what is wrong or how to fix it. This was the reality for every human being who ever lived for the overwhelming majority of our existence. For roughly 295,000 of the 300,000 years our species has existed, there was no medicine in any modern sense. And yet, somehow, humans survived. Not just survived, but thrived, spread across every continent, and built the foundation of everything that came after. So what actually happened when ancient humans got sick? How did they understand illness, respond to it, and live alongside it in a world with no doctors? The answer is far richer and far more sophisticated than the image of helpless people dying in the dark. Ancient humans developed a remarkable body of knowledge, a complex relationship with illness, and methods that, in some cases, modern science is only now beginning to fully appreciate. Let's begin with the hardest truth, the one that frames everything else. For ancient humans, illness and injury were constant companions, and death from causes we now consider entirely preventable was an ever-present reality. This is important to state honestly. We are not going to romanticize the ancient world. Life without medicine was genuinely dangerous. Infections that a course of antibiotics would now clear in days could kill. A wound that became infected could be fatal. Childbirth was one of the most dangerous events in any woman's life, and many women died in it. Children died at rates that are almost unimaginable to modern people in wealthy countries. Many estimates suggest that a very large proportion of children in ancient societies did not survive to adulthood. The diseases, the injuries, the complications that modern medicine handles routinely were, in the ancient world, frequently matters of life and death. But here is what is crucial to understand, and what makes the rest of this story so fascinating. The high death rates of the ancient world do not mean ancient humans were passive or ignorant in the face of illness. Quite the opposite. They responded to sickness with an enormous and sophisticated body of knowledge, accumulated over countless generations, refined through endless trial and error, and passed down with great care from one generation to the next. They were not helpless. They were doing the very best that could be done with the knowledge available to them, and that knowledge was often remarkably effective. Let's start with the foundation of ancient healing. Plants. The use of plants as medicine is one of the oldest and most universal features of human culture. Every human society ever studied, without exception, has a body of knowledge about which plants can be used to treat which ailments. This is not a coincidence, and it is not primitive superstition. It is the result of an extraordinary, multi-generational process of observation and experimentation that stretches back into the deep past of our species and very likely beyond it. Consider how this knowledge would have been built. Over thousands of years, in countless situations, humans observed what happened when particular plants were consumed or applied. Some plants relieved pain, some reduced fever, some helped with digestion. Some, applied to wounds, seemed to help them heal and prevent the wound from going bad. Some, of course, were poisonous, and that knowledge too was hard-won and carefully remembered. This information was accumulated, tested, refined, and passed down, becoming an immense library of practical knowledge held not in books, but in the memories of the people who carried it. The evidence for ancient plant medicine is genuinely striking. Researchers studying the remains of ancient humans have found direct traces of medicinal plant use. Analysis of the dental remains of Neanderthals, our ancient human relatives, has revealed traces of plants with no nutritional value but with known medicinal properties, including a plant containing a natural pain-relieving compound related to the active ingredient in modern aspirin, and traces of a type of mold that produces a natural antibiotic. This suggests that even our ancient relatives, tens of thousands of years ago, may have been using plants to treat pain and infection. The knowledge of plant medicine may be older than our own species, and modern science continues to validate this ancient knowledge in remarkable ways. A significant proportion of modern pharmaceutical drugs are derived from, or were originally inspired by, compounds found in plants. The pain reliever in willow bark led to aspirin. A compound from a particular flower became a vital heart medication. Treatments for malaria, for pain, for a whole range of conditions trace their origins back to plants that traditional healers had been using, in many cases, for thousands of years. The ancient healers did not understand the chemistry of why these plants worked, but through patient observation across countless generations, they had identified with remarkable accuracy which plants actually did work. This brings us to one of the most important figures in all of ancient human life: the healer. In ancient human societies, there were individuals who held specialized knowledge of healing. These were people who had spent their lives accumulating an understanding of plants, of injuries, of the patterns of illness, of the techniques that seemed to help. They went by many names across many cultures, and their roles varied enormously, but their function was broadly similar. They were the keepers of the community's medical knowledge, the people you turned to when something went wrong with the body. It is important to understand that these healers were often genuinely skilled and genuinely effective within the limits of what was possible. They were not charlatans. They had often apprenticed for years, learning from an older healer, memorizing vast amounts of detailed knowledge about plants and their uses, about how to set a broken bone, about how to treat a wound, about how to ease the passage of childbirth, about how to recognize different patterns of illness. In a world without written records, this knowledge lived entirely in the minds of these specialists, and it represented one of the most valuable resources a community possessed. The healer's role, however, was rarely purely physical, and this is where ancient medicine becomes genuinely different from modern medicine in a way that is worth thinking about carefully. In the ancient worldview, illness was very often understood not as a purely physical event, but as something with deeper causes, frequently spiritual or social in nature. This is one of the most important things to understand about how ancient humans related to sickness. We tend to assume that the physical explanation of illness, germs, infection, organ failure is simply the correct one, and that ancient people who saw illness in spiritual terms were simply wrong. But the ancient understanding was more complex and, in some ways, more holistic than that. When a person fell ill, the question was often not just what is physically wrong, but why did this happen, and why to this person, and why now? Illness was woven into a much larger understanding of the world, one in which the physical, the social, and the spiritual were not separated into the neat categories we use today. In many ancient and traditional societies, illness might be understood as the result of a broken taboo, a disruption in the social fabric, a conflict that had not been resolved, a spiritual imbalance, or the influence of forces beyond the visible world, and the healer's response would address these dimensions as well as the physical one. There would be the practical treatment, the plant medicine, the setting of the bone, the care of the wound. But there would often also be ritual, ceremony, the involvement of the wider community, and an attempt to address the deeper cause of the illness as the culture understood it. It would be easy to dismiss this as mere superstition, but that would be a mistake, and it would cause us to miss something important. Consider what we now understand about the Aozi, connection between the mind and the body. The role of belief, of expectation, of emotional and social support in physical healing is well documented by modern science. The phenomenon where a person's belief that they are being effectively treated produces real, measurable improvements in their condition is one of the most robust findings in all of medicine. Ancient healing, with its ceremony, its ritual, its mobilization of the entire community in support of the sick person, its powerful framework of meaning that helped the patient understand and make sense of their suffering, was very likely tapping into exactly these mind-body effects, even without any understanding of the mechanism. The sick person was not just given a plant remedy. They were given hope, meaning, attention, care, and the full support of their community. And those things have real effects on the body's capacity to heal. This points to perhaps the single most important factor in ancient healing, one that had nothing to do with plants or specialists or ritual. Care. Simple, basic human care. When an ancient human fell ill or was injured, they were not abandoned. They were cared for by the people around them. They were given food when they could not get it for themselves. They were given water. They were kept warm, kept clean, protected, and watched over. This basic care, the provision of nourishment and protection and comfort during the period when a sick or injured person could not care for themselves, was very likely one of the most important medical interventions of the entire ancient world. Many illnesses and injuries, given enough time, rest, and basic support, will heal on their own through the body's own remarkable capacity for recovery. The role of the community in providing the conditions for that recovery, in simply keeping the person alive and supported long enough for their body to heal, cannot be overstated. The archaeological evidence for this kind of care is genuinely moving. Researchers have found ancient human remains that tell extraordinary stories of survival against the odds, stories that are only possible because of long-term care from others. There are remains of individuals who suffered severe injuries or debilitating conditions, who lost the use of limbs, who suffered injuries that would have left them unable to fend for themselves, and yet who survived, in some cases, for many years afterward. The bones show healing that occurred over long periods. The only way these people could have survived is if others cared for them, fed them, protected them, and supported them through years when they could contribute little or nothing to the group's survival. This is one of the most profound things the archaeological record reveals about ancient humans. They cared for their sick and their injured, sometimes at significant cost to themselves, for extended periods with no guarantee of recovery. This compassion, this willingness to invest in the survival of a vulnerable group member, appears to be very ancient indeed. There is evidence suggesting that even our ancient human relatives, hundreds of thousands of years ago, cared for individuals who could not have survived on their own. The instinct to care for the sick, to not abandon the vulnerable, may be one of the oldest and most defining features of what it means to be human. Now let's turn to the question of injury specifically, because injury was perhaps even more common than illness in the ancient world, and ancient humans developed real skill in dealing with it. A life of hunting, of physical labor, of moving through dangerous environments, of encounters with large animals and difficult terrain, produced a great many injuries, broken bones, deep cuts, sprains and dislocations, wounds of every kind. And ancient humans developed genuine, practical expertise in treating these injuries, expertise that was often remarkably effective. The setting of broken bones is one example. The archaeological record contains many examples of broken bones that healed well, that were properly aligned and knitted back together in a way that restored function. This did not happen by accident. It required someone with the knowledge to set the bone correctly, to align the broken pieces, and very likely to immobilize the limb in some way while it healed, using materials like wood, bark, or hide to create a kind of splint. The frequency with which we find well-healed fractures in ancient remains tells us that this knowledge was widespread and effective. Wound care was another area of real skill. Ancient humans understood, through observation, that some treatments helped wounds heal and prevented them from going bad, even without any knowledge of the bacteria that cause infection. Various plant preparations, certain types of clay, honey in cultures that had access to it, honey being a substance with genuine natural antibacterial properties, were applied to wounds. Some cultures used materials that helped wounds close. The practice of keeping wounds clean, however imperfectly understood, developed in many places. Perhaps most remarkably, there is evidence that ancient humans performed surgery. The most striking example is a procedure called trepanation, the deliberate drilling or scraping of a hole in the skull. This is one of the oldest known surgical procedures, and evidence of it has been found in ancient remains across many parts of the world, dating back thousands of years. What is truly astonishing is that many of the individuals who underwent this procedure survived it. We know this because the bone around the hole shows signs of healing, which only occurs in a living person over time. The reasons for performing trepanation are not fully understood and likely varied, possibly to relieve pressure after a head injury, possibly for reasons connected to the spiritual understanding of illness. But the fact that ancient humans performed deliberate skull surgery and that their patients frequently survived is a powerful testament to the genuine skill and knowledge that existed in the ancient world. There is one area of ancient healing that deserves special attention because it touched every single human life and because it represented one of the greatest dangers anyone faced: childbirth. For ancient women, giving birth was among the most perilous events of their entire lives. We have explored before why human birth is so uniquely difficult. The large human head, the product of our oversized brain, must pass through a birth canal, constrained by the demands of upright walking. This makes human childbirth more difficult and more dangerous than birth in almost any other species. And in a world without modern obstetric medicine, without the ability to perform a safe surgical delivery when something went wrong, without any of the interventions that now save countless lives, childbirth claimed many women and many infants. But ancient humans did not face this danger unaided. Across virtually every human society, a body of knowledge and a tradition of skilled assistance developed around childbirth. The role of the midwife, the experienced woman who assisted in births, is one of the oldest specialized roles in human society. These were women who had attended many births, who understood the process intimately, who knew how to help, how to position the mother, how to assist the delivery, how to handle complications as far as was possible, and how to care for both mother and newborn afterward. This connects directly to something else we have discussed. The presence of other women, of experienced helpers, during birth is thought to be very ancient and may be a distinctly human adaptation. In most other primates, females give birth alone. Human birth, by contrast, has very often been a social, assisted event, surrounded by experienced helpers. The difficulty and danger of human birth made this assistance enormously valuable, and the knowledge of how to assist safely was one of the most precious bodies of understanding any community held, passed carefully from one generation of women to the next. The care did not end with the birth itself. The period after birth was also dangerous for both mother and child, and ancient communities developed practices around this time too. The support of other women, the sharing of the work of caring for a newborn, the knowledge of how to help a new mother recover, and how to keep a vulnerable infant alive, all of this was part of the accumulated wisdom that surrounded the most dangerous and most essential event in the continuation of the human line. Now let's address something that shaped ancient human health in ways that might be surprising. In some respects, certain aspects of ancient human health were actually better than we might assume, and better in some ways than what came immediately after. This connects to something we have explored before. Many of the diseases that we think of as major historical killers, the great epidemic diseases that swept through human populations, were largely products of a later period after humans began farming and living in dense, settled communities alongside domesticated animals. Many of these diseases jumped to humans from animals, and they spread most easily in crowded settlements where large numbers of people lived in close proximity, often with poor sanitation. Ancient hunter-gatherers, living in small mobile groups, were in some ways less exposed to these particular diseases. The small group size meant that a contagious disease could not spread the way it could in a crowded settlement. The mobile lifestyle meant they were not living amid accumulating waste. They faced enormous health challenges, but the specific challenge of large-scale epidemic disease was, in significant part, a later development. This does not mean ancient life was healthy in some idealized sense. It was not. The dangers were real and constant. But it does mean that the picture is more complex than simply assuming that earlier always meant sicker. In certain specific ways, the health profile of ancient hunter-gatherers differed from, and was sometimes better than, that of the early farming populations who followed them. So what is the full picture of what happened when ancient humans got sick? Let's draw it all together. When an ancient human got sick, they entered a world of response that was far more sophisticated than the absence of modern medicine might suggest. They would be cared for by their community, fed and protected and supported through their illness. They would likely be treated by a healer, someone with deep, specialized, hard-won knowledge of plants and techniques accumulated over generations. They would receive plant medicines that, in many cases, contained genuinely active compounds, some of which form the basis of modern drugs to this day. Their treatment would address not just their physical body, but their place in the social and spiritual world, mobilizing belief, meaning, ritual, and community support in ways that we now understand can have real effects on healing. And if their injury required it, they might receive genuinely skilled physical intervention, the setting of bones, the care of wounds, even, in some cases, surgery. Sometimes, despite all of this, they died. The limits of ancient medicine were real and severe, and many conditions that are now trivial to treat were then fatal. But often, supported by their community and treated with the accumulated wisdom of countless generations, they recovered. And the knowledge of what had helped them was remembered, refined, and passed on to the next generation of healers, adding to the immense and growing library of human medical understanding. This is the deepest truth about ancient medicine. It was not nothing. It was the beginning of everything. Every modern hospital, every pharmacy, every surgical theater, every drug on every shelf traces its lineage back to those ancient healers, patiently observing which plants helped and which harmed, to those community members caring for their sick at great cost, to those individuals performing the first careful surgeries, to the accumulated knowledge of 100,000 years of human beings refusing to simply give up in the face of illness. Modern medicine did not appear from nowhere. It grew slowly across an unimaginable span of time, from the patient, careful, compassionate efforts of ancient humans doing everything they possibly could with what they had. And underneath all of it, from the deepest past right up to the present day, runs the single most important medicine of all, the one that came before plants and healers and surgery, and that remains essential even now. The simple, powerful fact that when one of us falls ill, others care. Others stay. Others do what they can. That instinct, more than any plant or technique, is what carried our species through 300,000 years of sickness without doctors. And it is still, in every hospital room and at every bedside, the thing that matters most.